Hi, my name is Kelly Neal and this is Carol Cutler, and we are here to show you how to put a bedpan underneath someone for state competency practice. The first thing I'm going to do is I'm going to come and get my supplies, and what you will usually find for state competency is they will have all the supplies you need for your skills set out on the table, and you will go get them. Think of this as far as me handling the bedpan right now as if you just got this out of the utility room. It's a clean bedpan that's never been on a patient. Now there's two types of bedpans here. I have a traditional style bedpan and a fracture pan. And you do need to know the correct direction that it would go underneath the bottom. Usually for state competency, they use the regular traditional style bedpan. Fracture pans are more for hip surgeries, back surgeries, and this one would go underneath the bottom this way, where a traditional bedpan goes underneath the bottom this way. But I'm going to grab my bedpan, I'm going to grab some toilet paper, a hand wipe or washcloth, and usually the gloves will be in the room, but I'm going to go ahead and grab 2 sets of gloves for this skill as well, and then we're going to go ahead and come back over. Now I'm going to set my supplies right over here before I start my skill. And the next thing I want to do is I want to pull my privacy curtain. Now I'm only going to pull my privacy curtain part way since we're having this videotaped. But normally you would make sure your privacy curtain is pulled all the way around your patient. So then we're ready to start our skill. So I'm going to knock. Ms. Cutler, my name is Kelly. I'm going to be your CNA today. I heard you need to use the bedpan. Is that correct?
Yes, I do. Thank you.
Okay. So what I'm going to do is I'm going to put her head of her bed flat. When you're putting a bedpan underneath someone, you always want to make sure the head of the bed is flat. And when I put the bedpan underneath her, I want to try to avoid overexposure as much as I can. Now, they do realize you are going to need to uncover them to get the bedpan underneath them. There are 2 ways to put a bedpan underneath someone. You can have them bend their legs and bridge, or you can have them roll on their side, and usually you'll just ask the patient which they prefer. I'm going to show you both techniques here real quickly. But what I want to do before I get started here is put on my gloves. Now, as far as raising the whole bed up, you are not required to do that for state competency. If you are not going to raise the whole bed up, make sure that you do a nice good squat with your legs, that you're not going to kill your back here in the process. So the first way I'm going to show you is if I have her bridge. So when you have someone bridge, you would have them bend their knees. I'm going to go ahead and just fold these covers back. I'm going to kind of squat, use my legs. And the bedpan, this is the part that's going to come underneath her bottom. I'll just ask her to lift her bottom up, slide that under, and then she sits down on it, and I'll ask her if that's comfortable. So that is one technique you can use. The other way I would do this, and let me just have her come off of this real quick, is I could have her roll over. So I would ask her, Ms. Cutler, can you roll over on the side? And I will put this here along the bottom and I hold on to it as I have her roll back. And sometimes you might need to just adjust it just a hair. Like you're on there okay?
Yes.
Okay. So now that she's on the bedpan, I'm going to turn to my evaluator and let them know I'm taking off my gloves. You want to tell the evaluator every step that you're doing as you're doing it. So I'm going to take off my gloves, and these are going to go into the garbage can, and I will tell my evaluator I'm going to wash my hands. Now I'm going to raise the head of the bed up until she's in a comfortable sitting position, because it is more natural for her to, of course, to go to the bathroom in a sitting up position. Okay, I will give her the call light. And the other thing I want to make sure that I give her is toilet paper so she can clean herself afterwards. This skill is a bedpan skill. It is not a pericare skill. So the patient's going to wipe themselves, and then a hand wipe or a washcloth for her to clean her hands when she's done. And then I'll just let her know I'll be right, just to call me as soon as you're done, and I'll step out of the room. Okay. Now, as soon as I step out of the room, basically your evaluator is going to tell you it's okay to come back in. So I'm going to knock as I come back in. Mrs. Cutler, are you ready to come off that bedpan?
Yes, I am. Thank you.
Okay. So I have a new pair of gloves. I'm going to go ahead and I'm going to lower the head of the bed down, because I cannot get the bedpan out from underneath her while she's sitting up on it. Now, if I put this bedpan under her by rolling, I would have her roll to come off of it. If I put it under her by bridging, I'd have her bridge to come off of it. But make sure when you do take the bedpan off that you hold on to it so it doesn't kind of stick to their skin or end up rolling with them and getting spilt. Were you able to wash your hands?
Yes, I am.
Okay.
Thank you.
All right, so I'm gonna go ahead, and so before I actually have her lift up, I just kind of hold on to the lip of the bedpan right here and go ahead and lift up for me. And I'll be right back to get you all set up. Now, what I'm gonna do now is I'm gonna take my soiled cloth that she washed her hands with, and they will have pop-up linen baskets. So I will dump this in the soiled linen hamper. My bedpan, I am going to take this and I'm gonna dump it in the toilet. I'm gonna rinse it out, dump it in the toilet, wipe it out, and then I'll put it back, and they'll have a designated dirty area. They'll literally just have signs that say designated dirty area, and you'll set that there. And then I have to take off my gloves, and again, turn to your evaluator when you do this. These will go in the garbage, and then I'm going to tell my evaluator I would wash my hands. Now I want to make sure that Mrs. Cutler here is all comfortable, so I'm going to make sure she's covered up. She has her call light. Her bed's all the way in low position. Are you comfortable like this?
Yes, I feel very good.
And I'll pull my privacy curtains back, and I am done with this skill.